Hello, I'm Dr. Mark Topolski, an orthopedic surgeon with Gunderson Health System who specializes in hip and knee reconstruction. I grew up in New Jersey in a small town near Philadelphia. I ended up attending the Air Force Academy for college, and I did play some football while I was there. I ended up spending 6 years in the Air Force doing other jobs before I decided to go to medical school. Just prior to medical school, my wife and I had gotten married and we had already had our first child, so you can imagine it was a little bit of a long road with medical school and residency. Medical school was in the University of Virginia, and then off to the Mayo Clinic for my residency. At my time there, I spent extra time training and educating on adult reconstruction, again, of hips and knees. When I completed my time at Mayo, I was back into the Air Force as a surgeon for 4 years, spending some time in Afghanistan, doing some fairly complex reconstructions, as you can imagine. Once I completed my time in the Air Force, my wife and I came back to this area after we had learned so much about the Midwest, spending time at Mayo. And the job at Gunderson opened up, allowing me now to do about 500 or so hip and knee replacements a year. My wife and I now have 9 kids. Yes, 9. We're still open to adopting or fostering, but are probably done on our own. Thank you for trusting me and my team to complete your total hip replacement. Each year, I perform hundreds of these complex surgeries with my team. Hip problems have affected your quality of life long enough. Deciding to have surgery has not been an easy choice, but I think you've made a good one given your options. Since you're ready to move forward, I want to tell you what's ahead. We are ready to provide the excellent care you expect from Gunderson. Here's what we expect from you. Learn all you can about this surgery by completing your required education. Keep all your required appointments. Get your home ready for a safe recovery, and ask someone to be your recovery buddy. This person will help keep you safe while you're recovering. Your hip replacement workbook has details on these and many more topics. Start by signing up for MyChart, our patient portal. I encourage you to do this. It's a great way to communicate with your surgery team. Read your total hip replacement workbook and all educational handouts. Your recovery buddy must come with you to each appointment. Both of you need to know how to prepare for and recover safely from a joint replacement. It is important to bring your blue patient education folder to all appointments. Information will be reviewed and added each time we see you. You need this information to achieve the best results from your hip replacement. Now, here are some other aspects of joint replacement you need to understand.
Your surgeon will explain risks, benefits, and alternatives for hip replacement. After your questions are answered, you'll be asked to sign a form that gives permission for surgery. After hip replacement, you're going to have pain. You will have less pain as you begin to heal and use your muscles again. Rest. This is a long, slow healing process. Resting is important. Get up and take short walks every hour to help keep your hip loose. Use ice and elevation to help reduce pain and swelling. We'll tell you how long and how often to do both. Make sure your recovery buddy, family, and friends are well informed and ready to help. We'll provide information your home team needs to care for you.
Our support doesn't end at the hospital door. We'll check to see how you're doing at home. Call us with questions or concerns, especially if you have symptoms like these. Severe or lasting pain in your hip. More swelling in your hip or leg. Increased redness in or around your incision. You are less able to use your leg since your surgery. Your incision opens or it's draining. You have a fever of 101 degrees Fahrenheit or higher. This is what you need to know for successful recovery. To be fully prepared, you have to keep all your appointments and complete all your education. If you don't have paper and pencil handy, pause the video. You may want to take notes on how to contact my department.
If you have questions, concerns, or symptoms, use these phone numbers. For orthopedics and lacrosse, from 8 a.m. until 5 p.m. weekdays, call 608-775-2276 or 1-800-362-9567, extension 52276. After hours, weekends, and holidays, call the telephone nurse advisor at 608-775-4454 or 800-858-1400. 1050.
You have a lot to think about. Watch this video as often as you need to. Send us questions through MyChart. You have made a very good decision. We want you to get the best possible results from this hip replacement. When you're ready for surgery, we'll be ready for you. Thank you for choosing Gunderson Health System for your care.